It's estimated that approximately a third of people over the age of 50 will suffer from vertigo and dizziness at some point in their life. And it's really important to note that although you may be suffering from these symptoms, it is completely fixable and manageable, and no one should ever live with dizziness. My name's Jordan Loveridge, and I'm the founder of South Coast Dizzy Clinic. South Coast Dizzy Clinic is an expert and dedicated service assessing and treating all types of vertigo and vestibular related conditions. South Coast Dizzy Clinic was created because I saw a need in our community. I had a lot of people coming in who were suffering from vertigo and dizziness who had to travel up to Sydney to get treated. So I wanted to create a service down here in our local community. We treat all types of vestibular conditions, including vertigo, BPPV, vestibular migraines, vestibular hypofunction, Meniere's disease, and any other vestibular condition. Unfortunately, vertigo increases our risk of falling. So someone with vertigo is approximately 9 times more likely to have a fall than someone who doesn't. So if it is left untreated, there is a high risk that someone will have a fall and injure themselves. Someone attending South Coast Dizzy Clinic will come into one of our treatment rooms here, and there we will hear about your story, basically. So hear about what sort of vertigo you're suffering from, how long you've suffered, the symptoms you might be experiencing, the severity levels, what might some of the triggers and eases of your symptoms be. From there, we will educate you about the different types of vertigo conditions, how they present, what they feel like. And then from there, we will go through assessments. So those assessments include eye assessments, balance assessments, and some positional tests, which are looking for the crystals called BPPV. From there, we can work out what you're suffering from, and then we can best manage it from there. At South Coast Dizzy Clinic, we use VestiCam goggles, which are goggles that are used for the assessment of different types of vertigo and vestibular conditions. So when someone suffers from vertigo, their eyes will have a nystagmus, and these goggles are able to pick up that eye movement without any distraction of room light. So that means that our diagnostics are a lot more accurate than someone not using the goggles. By having this sort of technology in our clinic, it means that we're able to assess and diagnose people suffering from vertigo more clearly and accurately. At South Coast Dizzy Clinic, we pride ourselves on being evidence-based physios and health professionals, but we also care a lot about our patients, and we all have a high degree of empathy and show a lot of support to the people suffering from vertigo and dizziness who come to our clinic. We're all friends outside of work here at the Dizzy Clinic as well, which means that we get along really well, and it's a very friendly place to work. All our staff here are expert trained, which means that we have to be up to date with the latest and best research for the treatment and assessment of vertigo. We all attend competency-based courses. That is the most prestige type of course you can do in Australia, and also attend an annual conference called the NOSTA Conference, which is where all the experts and specialists within the dizzy community meet, and all the experts share their evidence. Many people who come into our clinic are quite apprehensive and anxious about us reproducing some of their symptoms. Whilst we may briefly reproduce some of your symptoms, these will be quickly eased once you work out what's wrong and how best to manage it. We work really closely with the neurologists and ear, nose and throat specialists, essentially south of Sydney. We are triaging all their dizzy patients and providing reports back to those specialists in the aim of speeding up their wait time so people can get better quicker. Being able to work with the ENTs and neurologists means that people are no longer having to wait 4 to 6 months on a wait list, and that means that they can get fixed quicker and get back on with their lives. Having a dedicated vertigo and dizziness clinic means that we have the latest technology being able to assess and treat someone with vertigo. It also means that we are highly trained, and this is all we do. We only treat dizziness, we only treat vertigo. So we are experts in this field. If you feel like you're suffering from vertigo or dizziness, contact us today or visit our website.